Okay, we're here with Jeanine, and she's going to tell us about a client she worked with. Why don't you just give us an idea of who she was and what she came to you for?
Yep. So she's a 47-year-old female who came with a diagnosis of inflammatory bowel disease. So she has an autoimmune disease. And she said that it started about 8 months after she retired from a very high-powered job. And she said this job was profit-driven. And so the more she worked, the more she made. And she said that she worked hard and made a lot of money. And she kind of connected those two together. Her symptoms, in addition to increased stools, she was having at least 15 a day. She was also having some pain in her lower sacrum that was diagnosed as ankylosing spondylitis. And she had some swelling and pain in her knee, her right knee, that was diagnosed as erythema nodosum. So it's an inflammatory disease. So she had stools, she had some pain, and she had difficulty sleeping. And so her goals for yoga therapy included not only the decrease in pain, but also improved sleep. She said that was her biggest problem. She was getting about 3 hours of sleep a night. And she was awakening not just because of the stools, but just because of the stress. She also had a history of some migraines. So we kind of took all of that into consideration as I developed her plan.
Okay, and what, so how did you start? Maybe you could give us what you did in the first few sessions and how that affected her.
Yeah. So the way that I saw it was that, you know, in Ayurveda, there's the doshas. And so this type A sense that she had about herself, and she even called herself a reformed overachiever, is that pitta nature of her that wants to really push even though she was sick. She was teaching yoga and exercising a lot. But she also had some vata imbalance, which is that inability to slow down. So I worked with her vata, this sense of depletion. And a lot of moving, breathing asana practices that really began with this posture of crocodile, makarasana, because I needed to slow her way down. Even the way she talked, she was very fast talking, she was very excited, she was very motivated, but also this sense of wanting to connect her breath with her movements. So that was the first thing. And then just all the asana that I recommended for her was this idea of moving breathing, like cat-cow, the sequence of moving from cat-cow to down dog to child, and then a progressive relaxation or yoga nidra. So that's kind of how we began.
Did she enjoy that practice?
She loved it.
She did.
I was a little bit nervous, I'm not going to lie, because she was super strong and she does hot yoga. So I was like, how is she going to respond to this? She loved it. And she said that she felt very nourished, which was a word that she said that she doesn't tend to feel in her practice.
And how, so she did these practices and maybe adjusted them. How, what happened because of them? What were the results?
So, I worked with her over a 3-month period. We saw each other 6 times. I tweaked her practice here and there. And over time, her sleep, that's the first thing we noticed, is her sleep improved from 3 hours a night to ultimately 7 to 8 hours a night. Wow. Her stools decreased originally from 15 down to 5, then down to 3.
Per day.
Per day. And then just overall felt better. You know, somewhere in there, she did start taking Humira. She was really hoping that she wouldn't have to, but she did. And, and her pain also decreased while using the sort of this vata balancing, moving, breathing asana.
Mm-hmm. So did she feel when you were finished working with her, she felt like she had practices she could use and it was a success? And
definitely.
You know, the thing I'm most struck by hearing you speak is the reduction in symptoms. I think you mentioned before this call, it was quick, right? Like how long?
Pretty quick. Like I'd say
how long before she noticed?
Yeah, like really after the first time that we met, maybe after a couple of weeks, she definitely noticed a decrease in the amount of stool, like the number of stools that she had a day, and a slight increase in her sleep.
Right. So she had something to work with, like she had motivation right away.
But she had also heard of yoga nidra, and so I recommended that she go ahead and practice that. I think she had downloaded a recording, but said I hadn't really started. So she started listening to that at least once a day and then twice a day. So that was also part of her practice that I think benefited her.
Great, great. Well, thanks. That's it's always nice to hear successes and the way it can go. And you clearly made some good choices right at the beginning. So that's good for you. Thank you.